Welcome to today's session on girls and women with ADHD and autism. We are joined here by Associate Professor Lotta Borg Skoglund of Medical Sciences at Uppsala University. Lotta has kindly agreed to answer some questions at the end of the talk, and as yesterday, you can post these at any time on the conference app. Okay, so over to you, Lotta.
Thank you so much. And again, thank you for the possibility to talk about this important topic to all of you. I really enjoyed yesterday. It was a great day, a long day, a lot of impressions. And now finally I'm invited here to talk to you about what I think is the most important topic in this world. Of course, I'm biased. But for me, this story started actually, I would say 5-6 years ago, when I met an old friend from med school who had, taken another path. She'd become a, what do you say here? You say OB-GYN, obstetrician, gynecologist. Right? And we had lunch, and we started talking, and she was complaining and going on about a group of her patients that she was really concerned about, but also that she was kind of really frustrated with. She said, I have all these girls, and they come to my clinic and, we talk about things, and it seems like they don't listen at all to what I'm saying, and they don't act on my advice, and they claim to, be allergic somehow to hormonal contraceptives, and, everyone knows that you don't get depressed by hormonal contraceptives. It has been an issue. We have, covered that in meta-analyses, and, the jury is not out on that one. And, and I keep telling them that they are wrong, and but they don't listen to me. And they put themselves at risk. And they come back to me, and they have gotten pregnant, they have to do abortions, they are victimized, It's, this is something that was really, really frustrating to her. And I just sat there and I listened, and I thought, well, you know what, this reminds me a lot about my patients. If not about myself, so at least also about my patients. And I said, do you think that we might have the same patients? Me in my psychiatric clinic and you in the youth clinic? And we started exploring that. And it turned out, I'm going to try to make that point today, that because I said to Helena, I said, I do think that they might get depressed, because many of my patients, many of the young women with ADHD and autism, they do get depressed or get emotionally dysregulated by their hormonal contraceptives. I keep hearing that. That cannot just be chance, right? And she says, no, you're wrong. They're wrong, she said. And at the end of this talk, I would like to claim that Helena was wrong. And me and my patients, we were right. And we actually proved that in research. And that's when research gets really, really interesting, right? When you can take a question from your patients, and then you can prove it by science. So the perfect storm, hormones, in ADHD, autism, and females. So when I started hearing these stories from my patients, I went to my publisher and I said, I want to write a book about female ADHD. I want to write the story of my patients, about the girls and the women, what they are telling me about their lives. And my publisher said, well, Lotta, another book about ADHD. There are so many books about ADHD today. Come on, another one. And I said, yeah, I know there's a lot of books about it, and it's a good thing that, we have raised awareness about this, and I know that there are many books, but, just this book. Please let me just write this book. And I wanted to put my patients' stories in a research context. So that was what I was aiming for in this book. And it's coming out in the UK in October, November, by Jessica Kingsley's publishing. Thanks to Sophie very much. So I went about and I thought I would dive into the pool of knowledge and try to put my patients' stories and testimonies into a research context. It showed up, though, you are not supposed to dive into that end of the pool. the pool were about the research knowledge about females and ADHD autism. It's very shallow. You can hurt yourself if you dive there. On the other hand, in the end, the boys' end of the pool, you can play water polo there. You can do backflips. It's a lot of research. It's 100 years of research of pharmacological treatment of children's brains. There's almost no condition in psychiatry where we stand on such solid research ground, right? Girls' end, not so much. You're not supposed to die there. So I went about and I did my research and I stumbled upon this quote from the French philosopher, writer Albert Camus. And I read that and I thought, well, this is something that I hear a lot. Not perhaps in these particular words, but on this theme, right? Most people do not understand that some people use enormous amounts of energy just to be normal. This is something that the girls and the women that I meet in my clinic that comes to me for assessment for ADHD, ADD, autism, tell me about. They may not use these exact words, but there's something, and we've heard it yesterday many, many, many times, the testimonies of that, about this secret that I am different, I am flawed, and this secret that needs to be kept a secret, because otherwise, what would people think? So those of you who listened yesterday, you saw this one, and I think it deserves to be repeated. ADHD and autism, they are serious conditions. For ADHD, Russell Barkley and his colleagues showed that you will live 8 to 13 years shorter than a matched individual of the same sex, age, and socioeconomic situation. 8 to 13 years just by fulfilling these letters in any combination. That's serious, right? And it is a good prognosis. And if you bear with me, I'll try to walk you through how I view this and try to suggest a common language for all of us, researchers, clinicians, patients, loved ones, so that we know that we talk about the same thing and that we aim for the same goal. However, it is very, very, very sparse with the literature, the research, and the tools for females and for gender-specific challenges here. So that's a problem. And Ingrid, she is only 7 years old, and when she came to me and when she came with her parents, she'd complain quite sometimes when she'd come home from school and she said, I'm so stupid, I don't get it, I'm never going to make it through school. And fortunately, her parents were not stupid and they did not think that their daughter was either, so they came. And it turned out when we did Ingrid's assessment that she is far from stupid. She actually has an IQ of 140. And still, she views, her life as an uphill struggle from here. She's 7 years, and the future is dark. And fortunately, then, Ingrid's parents picked up on that because the people in school, or the teachers in school, and the staff in school, they didn't. They thought Ingrid was the perfect pupil. She was so compliant, so nice. She always tried to help others, and she was so eager to please. She did not disturb anyone. And perhaps that would have gone on for quite some years if Ingrid would have followed the usual trajectory. And this is what you asked me to talk about, why we fail the girls and what to do about it, right? Tove, she is 14, and I've borrowed, or I stole some of the quotes in my book and in this lecture from my patients. And Tove, she said, in my brain, it's like I'm living on a huge, airport. There are planes coming in from the entire world. There are planes going out to the entire world. And everything needs to be kind of matched perfectly. Otherwise, there might be really serious accidents. And I feel so stressed out about this because if something changes, it might be just a minor thing that happens way out in the periphery of this airport. It changes everything. And I don't have anyone who works in my control tower. So I have to do all of this manually all the time. And after school, I'm just so drained with energy. There's no room to hang out with your peers or go to your basketball training or do anything really, but go home, lay down in a dark room, plug in the energy outlet and try to recharge energy until everything starts all over again, tomorrow again. She's missing out on a lot of life. However, she's performing very well in school. And Susanna, she's turned 19. And for her, it's a little bit different. She feels like she doesn't have she said, I don't have a servo in my volume button. It's like my brain is either, it is kind of stuck on 0. Impossible to get any energy to do anything. It's like so hard to get up in the morning. It's so hard to empty the dishwasher, to do the homework, to basically just raise your hand to brush your hair. It's like I don't have any energy. And then she says, just suddenly, without I know why or without really anything happening, this volume button just turns up to 100. It's so much fun. It is so much fun to organize your CDs, stack them in color. It's so much fun to organize this in an Excel arc. It's just another piece of this chocolate. It's so good. She knows that eating the other half of this chocolate bar will probably make her sick because it used to do that. She knows that. She's repeated this pattern many times, but it's so good. And it's like she's not in control. And turning 19, and when your peers are getting more and more in control of their energy levels, of their activity levels, this turns out to be a huge handicap for her. And she feels scared about herself. And she said, I understand that others don't trust me because I can't trust myself either. That takes a toll on your self-esteem. So yesterday we talked about mental health, right? Because regardless where we start, regardless if we have a diagnosis or not, what we're aiming for is to live a life with as much good mental health as possible, right? And we talked about this yesterday, and for those who didn't join that session, just a short reminder. For us humans, there are some ground prerequisites that we have to establish to be able to talk about mental health, right? We need to have the ability to understand and to regulate and to communicate our emotions to others. We need the ability to direct our behavior towards the future. We need the ability to understand that the future, there are many factors there that we cannot affect, and we have to accept and adapt to that. And we need the ability to initiate and to sustain healthy social relationships. If we can agree on this, I think it's really interesting to look on, from a behavioral perspective, what is ADHD and autism really about? And when you talk to a lot of patients that I do with ADD, ADHD, autism, they tend to cluster around different aspects of their lives that constantly is difficult for them. So this is just I just arranged them in an order that they usually come up in discussions. And then I've tried to translate it into what psychologists or neuropsychologists would arrange them into different categories that we actually can measure Because I think this is interesting. This kind of takes us one step, anyway, towards, being a little bit more skeptical about the diagnosis and how much we know about someone just from a diagnosis, and look beyond the diagnosis and see what is actually happening and how can we understand how the brain works for everyone, for all of us, and what can we take with us to understand how girls and women with ADHD, autism, and what they struggle with. So I would say a lot of my patients say that it is so busy, this airport, it is busy. It is so hard to overview things, to plan, to structure, to prioritize. Everything seems equally important to do right now for me. And also to calculate how much time something would take. And when I'm finished, how do I know that? That would be what you, if you're a psychologist, would probably call some part of the executive functions or central coherence. How this airport fits together. Many of my patients will also say that they have difficulty regulating things. Like Susanna says, it's something broken with the servo here in my volume button. And you have to listen, and when you listen to the stories, it's so much more than just energy and activity. We talk about hyperactivity, for example, in ADHD. But regulating things is much more than that. It's about regulating your energy levels. It's about regulating sleep and awakeness. It's about regulating appetite. And it's about regulating your emotions. And when you understand ADHD, ADD, autism in that way, remember the 4 prerequisites for mental health, what came on top? Emotions, regulating your emotions. We start to move towards why life can be so difficult without it even be visible for anyone else. A lot of my patients also say that my brain is like an open computer or email box without a virus or spam filter. Everything just, comes in. And everything seems equally important. And it's like I have to process even irrelevant stimuli. I get so tired and I get so confused because I don't know what to act on, because everything seems equally important. And if you listen really carefully, it's not just the external world that bombards us with all this, different stimuli. It's our own bodies as well. I feel my own body all the time. It keeps sending me signals about stuff. My stomach, my head, my neck. I feel my clothes. It's like, And for Ingrid, she said to her mom, because her mom was really she was really worried because Ingrid, she just wanted to use the same clothes over and over and over. And the parents started by buying her just the equal set of, what's it called, mjukisbyxor in sweaters, sweatpants. But then they say it becomes kind of a hierarchy within the 20 equal sweatpants, because Ingrid doesn't want to use those that's been in the laundry, because they are a little bit stiffer. You can feel kind of something there. And they argued because her mother thought that children they're not that nice. Eventually, her peers will start commenting on that, or perhaps someone say you smell, or your sweaters there are holes in them. So she really wanted Ingrid just to put on something that wouldn't put her at harm's way of being bullied. And they were fighting about that. Every morning, 20 minutes, 40 minutes, Ingrid was crying, Mom was crying, the sibling was crying because, everyone was so stressed out. And suddenly, one morning, Ingrid says, okay, Mom, I'll put on the jeans. Okay, I'll do that. But then I won't hear anything what the teachers say during the whole day. Because she could always feel how this, stimuli would constantly send her messages, and she couldn't filter them out. And a lot of my patients also say it's so hard to shift focus when I know that this is not working anymore. I should try something else. Or I should try to jack out of this rumination of negative thoughts, that it's constantly just going round and round and round, destroying my relationships. It's toxic for me, but I can't just, shift. Do you agree that these 4 kind of domains are really common, right? And then back to the 8 to 13 shortened life expectancy. What is that about? What is it with these different combination of letters, ADHD, ADD, ASD, that would take 8 to 13 years out of our patients' lives? Well, if you look back at these difficulties, and if you understand what you're struggling with here and what you're facing, you'd see that these many of these years are also possible to recover, because they are due to lifestyle factors. They're due to, it is so much more difficult to establish and sustain healthy routines regarding diet, exercise, sleep, stress, recovery, relationships, substances, alcohol, nicotine, drugs, and economy. These are, I call them actually the 7 deadly sins. And again, it's not facts that is missing for, I would say, any of my patients, regardless of age. Everyone knows that it's better to eat broccoli than ice cream, that you should probably exercise like 3 times a week, not 3 times a day, or 3 times your entire life. That it's probably best to sleep during the night and be awake during the daytime hours. And, everyone knows that. And still, there are so many of us struggling with this easy thing. And you tend to get some really bad advice, again, from normotypical people, right? Because if you don't see it this way, then it becomes, the norm there. They are trying to help you. They are, right? But if they don't understand what we are struggling with, they will give us really bad advice. So they'll say, well, eat until you're full. Can I? Really? How many cinnamon buns am I allowed to have? Like, well, until you're full. Really? Yeah, really, because no one will eat 10. Yeah. You know what? Some of us will. And stay in bed. Your body will know when you are recovered and when you are rested enough. It will know, and then you will just go up and do all the things during that day. Well, no. I don't know how many of you that can sleep for like 48 hours after a conference like this. All the stimuli, all the input. And again, with the broken servo, you can't really trust your gut feeling here. Because when your energy is kind of stuck down on 0, it's not more rest. There's no rest that can take care of that energy depletion. It's activation. That's really unfair. You can't trust your gut feeling there. And it's very important, we all know that. We all in some way, work in psychology or psychiatry, and we know how damaging it can be to kind of press down your emotions, right? So we often get the advice, let it show. If you feel that your boss is saying something really stupid in this meeting, you should probably just say that straight out. Well, no, it turns out. We talked about that yesterday, how difficult it can be with ADHD in the workplace if you're not aware of this, and if you're not aware that you need to kind of tweak these advice a little bit, right? Or you get used to it, like Ingrid. Just wear these jeans, you'll get used to it. No, it turns out you don't habituate to incoming stimuli in the same way as normotypical people do. Or my favorite advice, since I used to be an addiction medicine specialist, don't be so uptight all the time. Come on, be like people. Have a drink, relax. Turns out a really shitty advice as well. if you have ADHD, ADD. And you know about that huge comorbidity. So, let me see. You will probably have to carry me out of this stage because I won't stop talking because this is so important. So I have absolutely lost track of time. Could you please just tell me when it's like 10 minutes to go? Yeah. Perfect. Yeah. Focusing on you, but I will. Good. And when I don't stop talk, just carry me out of the stage. But first, let me tell you a little story about Eddie and Edith. This is really interesting because this I came across when I did the research for my book. So I want to try this on you, okay? So think about Eddie and try to kind of write a little story about Eddie, the ADHD boy. And just, don't pull back. Just, take everything, every stereotype that you can think of and just throw it in. Can you see Eddie? Can you see Eddie in the classroom? You see Eddie on the football field, Eddie at home, okay? So Eddie is having some trouble. And a group of researchers actually wrote this story about Eddie. And they handed it out to a group of healthcare professionals, teachers in school, and parents. And now you're going to be that crowd. So I'm going to ask you, okay, read this about Eddie. Think about Eddie. What do you think? Why is Eddie, suffering? Why is he struggling so much? Why is it so much, thing about Eddie? What do you think?
Doesn't pay attention in class.
Yeah, what's his problem? What's his problem? What's Eddie's problem? Can't sit still.
He's sad. Fidgets too much.
Yeah, but could you be more specific? What's Eddie's diagnosis? What's his ADHD? Yeah. Yeah, it turns out that was what the healthcare professionals, the teachers, and the parents said. Well, Eddie probably has ADHD. Okay, so Eddie probably has ADHD. What should we do with Eddie? Medicate, yeah, sure. There's a rationale for this, right? We know what to do with Eddie because we should get him an assessment, and then he should get evidence-based multimodal treatment. Probably some medication as well, right? Yeah? So that's not kind of the take-home message of this story, though, because it's good that we find Eddie. We should help Eddie. The problem is, I don't know, you can decide. Take this story, take the exact same story, and you just edit out Eddie. You edit out Eddie, and you edit in Edith instead. Exact same story. And you hand it out again to another group of healthcare professionals, teachers, and parents. And now what? Now I want to know, what is Edith's problem? Yeah, so there's something with her emotions, yeah. So what is the, come on, give me your best.
Borderline personality.
Yeah, there's something going on there that's not sound, And don't you want to know a little bit more about Edith and her, her peer relations? And her parents. Edith's mom, she works a lot, Of trauma. Yeah. Yeah.
Lack of a father.
Exactly. Where's the father here? And what about Edith? She's seeking so much attention, She's putting up all these posters on Instagram, with this clothes. It's really appropriate. She's like, what's going on here? She's hanging out with these older boys. Could you be victimized? Could it be sexual abuse here somewhere? You see where I'm going? Okay, so there's a lot of things that we're thinking about Edith. What do we do? What do we do with Edith?
Send her to counseling.
Exactly. She should probably talk to someone, right? Yeah. She should probably talk to someone. Edith has some issues that needs to be resolved. Perhaps her parents need to go there. Perhaps it should be family counseling, right? Because there's something going on there back home that's not good. I'm exaggerating, of course, right? But the problem is that the reality is not that far from this exaggeration. So Edith will end up at the school counseling for a couple of years. That's good. It's really good, and I'm not saying that it's not good to talk about this. Edith had a lot of things that she needs to talk through. But the problem is that the years keep on, rolling by here when she is in counseling. And then perhaps she gets to the child and adolescent psychiatry, and she gets some other psychotherapeutic intervention. And now I'm starting to close up on where the research starts here and what we are trying to do. Me, Helena, and the rest of our guerrilla group of female researchers without funding. That's what we call ourselves. So what we see in the research is that girls with ADHD, ADD, and autism, I call them the invisible children because they are like Ingrid. They fly under our radar. They do have emotional instability, verbal impulsivity. They do experience stress and school failure. And as for Ingrid, in regards to her high, intellectual ability, she should be one of the top students, right? And she feels like, and she is failing. She struggles socially. She develops a low self-esteem. And when it comes to girls with ADHD and ADD, they suffer from bullying. When it comes to boys with ADD, ADHD, they're both the victims and the perpetrator of bullying. And if you don't understand how your brain works, then you will end up in a lot of difficult situations, and you will end up in the obesity award, perhaps, because you can't regulate your appetite. And you will try to find solutions for this busy, messy brain, and you will start smoking. And the research tells us that girls with ADHD, ADD, they start smoking, they start using alcohol at an earlier age than their peers. Okay, so these are the invisible girls. We learned from yesterday, right, that you don't grow out of neurodevelopmental disorders, right? Oh, most of us doesn't, anyway. So these girls, these invisible girls, they will grow into young women with ADD, ADHD, autism. And they're not invisible anymore. The slogan for the 10 minutes, I have to talk so much faster. The slogan for young women with neurodevelopmental disorder would be comorbidity and risk-taking. They are in our face. And what happened when we got our data set is that Helena called me again. She's like, Lotta, look, have you seen? And I thought like that her dog maybe had been run over or something because she was so upset. And she said, have you seen the data? I said, yeah, I've seen the data. What's all the anxiety about? Have you seen how these girls are struggling? And I said, yeah, this is exactly what I told you. Because when you see the data and you see what these young women are experiencing, it's like a flipper game. They are all over the healthcare system. They consume so much healthcare resources, so it's not that they're invisible to us, but the paradox is that we miss them again. We miss their ADHD, their autism again. Because they have these increasingly impaired by emotional dysregulation. They come to us with depression, anxiety, eating disorders, self-harm, suicidal ideation, suicidal behaviors, substance use, addiction, sexual risk-taking, trauma, victimization. And we miss them again. So the problem that we will like to address in our research group is that girls and women with ADHD, they are at risk for all these externalizing risk-taking behaviors. And perhaps we can find them at the youth centers, because we need to pick them up somewhere. They actually have an earlier sexual debut, and they are the girls and the women that Helena described to me, that don't act on the contraceptive counseling. And they end up with sexually transmitted diseases, sexual exploitation, victimization, unwanted pregnancies, abortion, underage parenthood. The problem is, when again we try to dive into this pool of knowledge, you should not dive there either. Because females with psychiatric conditions are often excluded from randomized controlled trials. These studies, they are really expensive, and you don't want individuals with psychiatric disorders, and you don't want individuals that can get pregnant in those studies, right? So it's a very, very thin layer of knowledge here. And Anja said, I can't stand the pill. I have to manage my contraceptive situation in some other way. And that turns out to be a really bad advice if you have ADHD or ADD. This is a study that came just before Christmas. like a Christmas present for us in our research group. And it actually shows that what our patients are saying, that they are suffering even more from hormonal fluctuations than neurotypical females. That is true. In this study, you could show that it is actually during the luteal phase, the 2 weeks following ovulation, where the progesterone levels are increasing, that females develop their psychiatric disorders if you have a vulnerability to psychosis, bipolar depression, suicide, and relapse into alcohol addiction. More anxiety, more stress, you relapse into your eating disorder. And interesting enough, they also show that you have less subjective effect of alcohol or nicotine and cocaine. And they call out to all of us to use these predictable periods of hormonal fluctuation to actually tailor contraceptive counseling and psychiatric care and medication. So I had to kind of pick my old books from med school up, and I had to read up again. I didn't expect I had to do that as a psychiatrist, but it turns out that I have to know where my patients are in their hormonal status. Because the first 2 weeks of the menstrual cycle, estrogen is increasing. And estrogen is like super fuel for the brain. It is intimately tied to better executive functioning, better emotional regulation, better sleep. You see where I'm going here? And then day 14, ovulation. The ovulation bladder turns into the yellow sac, yolk sac, corpus luteum, start producing progesterone. And clusterfuck, as one of my patients called it, clusterfuck. 2 weeks of emotional dysregulation and things that happen during these weeks that have consequences, in the long run. So this is important. The interaction. ADHD, autistic symptoms do vary across the menstrual cycle. Our patients have been telling us that for years. We just haven't listened to them. Estrogen affects mood and emotions. Dopamine, that is dysregulated in ADHD, ADD, is actually potentiated by estrogen. So this has a perfectly natural explanation. They're just telling it like it is. Should we then continue to use the male norm, or should we start thinking about gender-informed assessment and cyclic treatment strategies? I think you know the answer, or my answer to that anyway. So what we're showing is, so Helena said we are so successful here in Sweden. We are successful in Sweden. Youth centers has actually decreased teenage pregnancy from 15% in the 70s to below 2% today. And that has nothing to do with morals. That is everything to do with the transformative transformative years, or important years, where we females have the chance for an equal lifestyle. These years are about education and about establishing yourself in society. If you have a child too early, you risk missing out on this. And we're very successful, we're very proud of that. And what we thought is should we be that, or are there maybe a group that we are missing here? And yes, it was. And what we saw in our first study here is that girls and women with ADHD have 6 times increased risk of becoming a mother while they're still themselves just a child. And then, of course, we had to try Anja's question. And it turns out I was right. Helena was wrong. Hormonal contraceptive is not associated with depression overall. Looking at females with ADHD, they have a 5-time increased risk of developing depression using the commonly used hormonal contraceptives. 5 times increased risk on top of an already high risk, right? And the study that we are supposed to publish now in a couple of months is this, where we show what we have been talking about here, that females get their ADHD diagnosis approximately 4 years later than males. 4 very important years. 4 years of lagging behind socially, in school, and developing comorbidity. So this is just in conclusion what I've been saying and what we are trying to do in our little guerrilla group and what we are aiming for, the solution. We need to find and support the girls in time. We need to improve the knowledge. This is one arena for that. We probably should think about targeting reproductive counseling, healthcare counseling overall. Perhaps we should think about titrating ADHD medication. ADHD medication affect dopamine levels. Dopamine levels are affected by estrogen levels. Again, we use the male as a norm. And what I really recommend all of you, if you have the chance to enjoy the multidisciplinary research environment and clinic. Our patients, it ended up, did not respect that I was a specialized psychiatrist and Helena was a specialized gynecologist. They needed us to work together. This is what we think. We think that knowledge is power. We think that is also what I'm aiming for by simplifying, these different domains of how the brain works when you're neurodiverse. Try to get us a common language to talk about this. To try to save the 8 to 13 years that we lose and to find more girls earlier. So, what can you do yourself? Because I'm a huge fan of self-efficacy and empowerment, and I think that if you get the diagnosis, someone said yesterday, and I'm going to carry this with me, and I'm going to steal that quote straight up, use it again. She said, because diagnosis is a privilege, right? And she said that she always includes self-diagnosed individuals in her study because diagnosis is a privilege. And that's really true, right? And diagnosis is also power because it's the power to start making other choices in your life. Self-efficacy, keep track of your own vulnerable periods. 5 years ago, I didn't even ask my patients where they were in their menstrual cycle. Now that is an extremely important part of my medical decisions, right? The 7 deadly sins. Seems simple, but it's absolutely essential. And I think we all should demand empowered precision health based on your unique ADHD, autistic profile, and your hormonal status. And what should we do? Well, we should stop overlooking the girls. We need to remind ourselves about Eddie and Edith, and we need to remind ourselves that there is biological and social expectations factors here in play. That girls, when they present, they will present with comorbidity. We need to see it for what it is. And if I could just pick out one word, when people say, how should we find the girls earlier? I would say overwhelmed, exhausted, risk-taking, trauma, victimization. And we need to do this, again, more of this, educate and support to get the girls to an early assessment, interventions, and to always factor in the hormones. So why don't you see me? So Hannah here, she would describe life as an uphill struggle. I'm trying to find myself, I'm trying to be accepted, I'm trying to fit in, and people say that I'm attention-seeking. I camouflage and I cover up, and people think that I'm doing good. What I need are life skills. I I need critical reasoning, problem-solving skill, coping strategies for my emotional dysregulation. You can't leave me hanging, because look at the research, look at the data. Look at our data set. You will feel what Helena felt when she looked at it. We already know what happens. So thank you so very much for having me, and to giving the girls and the young women a voice here as well. Thank you.
Thank you, Lotta, for that really, really interesting talk. So we've got quite a few questions here. I'll try and kind of group them into broad categories if I can. We've got quite a few questions about ADHD and neurodivergent women and menopause. Is there anything that you could kind of share with us on that front?
Yes, and I would start suggesting, Sophie, you invite me again, because this is an entire lecture. I had to cut it out, because I know I was going to overextend my visit already, or my lecture. But that's a really interesting topic, and we're just starting. And this is also something that we actually bring into our research, because again, the hormones start to fluctuate around menopause. And it's not just the year when you have your menopause, it's 10 years, up to 10 years around those years. And again, these are important years, because this is my life right now. I'm 47. That should be, if you look at the research, the mean age for perimenopause. Estrogen levels starts declining. Progesterone levels also decline. So if you have a lot of PMS due to progesterone levels, that might be easier. But many, many women come and they experience brain fog. And all this symptoms that may be climacteric symptoms, but also maybe exaggerated or exaggerated ADHD symptoms. So that's a really difficult overlap for a clinician and for the patient to disentangle. Many also come because they fear that their mind is failing them and that they're developing dementia. And the really strange thing is that there is no research, or that's not so strange, I'm getting used to that, but there is no research done on, or almost no research done on older adults and central stimulant medication, and of course no research done on central stimulant medication and on older women, but there are some studies done on older or menopause women and central stimulant medication. They don't have ADHD, but their menopause symptoms get very much better. So there's something there, I think. A lot more research needs to be done. So please join the movement.
Thank you. And we've got quite a few questions about diagnoses. How can we diagnose girls early who are high functioning and often don't speak up? And as we're only able to access support with a formal ADHD diagnosis, what would you kind of add to diagnostic criteria so fewer women and girls slip through the cracks?
Yeah, that's a really good question. And so first of all, I think when the child themselves are communicating that they're struggling, it's our duty to listen to them. So overwhelmed, again, anxious, trying to fit in, we need to listen. It may be ADHD, ADD, it may be autism, it may be something completely different, but we should listen, and ADHD, ADD should be at least one of our hypotheses, I think. So that's the first. I wrote this book also, and it's, as I say, I have rewritten it and updated it, so it will, when it comes in November. My hope is for this also to be a book when you're waiting for assessment and diagnosis, and potentially also not needing it. Again, hopefully in 20 years we look beyond the diagnostics and we see our own unique brain map and ADHD profile, and then perhaps we don't need it, because not all of us need medication, right? I think self-awareness, that's one of the most powerful tools that we can work with.
Okay, we'll have to finish there. There's lots of questions on the app, but yeah, thank you very much, Lotta.
Thank you so much.
Amazing.
Lotta.